Housing is very important for health. The quality of housing, the affordability of housing, and the security of housing are all important. Let's take quality. We produced a report in Britain recently, a few weeks ago, that we presented in Parliament on left out in the cold, fuel poverty. Fuel poverty has three components: poverty, the quality of housing, and the price of fuel. Poverty is desperately high in the UK. The quality of housing is desperately poor. The insulation of housing is poor compared with other European countries. And the cost of fuel is 20% higher than the European average. We said in our report in the UK that 1/3 of all households, 1/3 of all households are living below the minimum income threshold and in housing that does not come up to energy conservation level C, that being the level where you're not losing heat. Now, fixing that, we said, will take money. £6 billion a year for the next 10 years, £60 billion. But that should be seen as investment, because if you invest in better quality housing, that's good for the planet. People are needing to burn less fossil fuel to stay warm. And if they don't stay warm, it damages children's lungs, it damages early child development, it damages mental health of children, it damages their learning, and it increases adult mortality. And then affordability. Housing is part of poverty. If housing costs too much, you can't eat healthily. If you can't afford the rent, you can't afford to buy healthy food. So the affordability is key. Poverty causes poor housing, expensive housing causes poverty. And security, if you can be evicted at the whim of a landlord, living with that kind of insecurity is very bad for mental health and potentially physical health. So housing's absolutely vital. Then the question is, yeah, but what can doctors do? Doctors aren't builders, they can't construct healthy housing, but doctors firstly can work in partnership with others who are involved in providing housing. In the UK, we've now got an initiative with house builders. We're trying to get the house builders to provide good quality, affordable and high quality housing, as well as local government and social housing. So doctors can be advocates, they can work in partnership, and they can see. We did a report with a child doctor, a paediatrician in Liverpool in the north of England, because he could see his patients, these children their lungs being damaged by poor housing. So he became an advocate. So the individual physician is important because she or he sees the effects of poor housing.